Hey everyone, my name is Alexis Hunter. I'm the community liaison for Wilmington Health, and I'm joined today with Dr. Jayme Stokes, who is a general surgeon on the Wilmington Health surgery team. Dr. Stokes, thanks so much for being a part of this conversation today.
Thank you for having me. It's a pleasure to be here.
Yeah, absolutely. So tell us first just a little bit about your education, about your experience before coming to Wilmington Health.
Sure thing. I grew up in Greenville, North Carolina, so I'm an Eastern North Carolinian by heart. I went to undergraduate in medical school at the East Carolina University up in Greenville, and then completed my general surgery training at the University of Virginia, and then did a fellowship in laparoscopic and bariatric surgery at the University of Virginia as well. I spent about 5 years at a community hospital in Charlottesville, Virginia, and then I've been fortunate to return to Eastern North Carolina and be a part of the Wilmington Health family.
Awesome, that sounds great. Dr. Stokes, one of your specialties is bariatric surgery, also known as weight loss surgery. For patients considering bariatric surgery, what are the key things they should keep in mind when making this decision?
Thank you. Bariatric surgery is a very rewarding field. We are able to offer surgical options to patients who are overweight or obese, and they have gone through non-surgical efforts such as dieting and exercise. Maybe they've gone through a structured weight loss program that didn't incorporate surgery, and they've either had some success that they ultimately regained the weight, or they're just struggling to achieve any sort of meaningful success through those measures. Bariatric surgery offers patients another tool in their toolbox, if you will. We can offer them surgeries such as the Gastric Bypass or the sleeve gastrectomy that can really help motivate and jumpstart their weight loss, and it's a very rewarding field.
Sure, yeah. How do you and the patient determine that they are a good candidate for this type of surgery?
We typically start off by following the National Institute of Health, or the NIH guidelines. And those state that a patient must have a BMI of 40 or greater, and a BMI is a measure of a patient's weight versus their height. And so patients who have illnesses related to being overweight, such as hypertension or high blood pressure, diabetes, sleep apnea, they can be given a 5-point credit, so their BMI could be as low as 35 and then qualify for surgery. And so those are the numbers that one looks at before deciding whether a patient's a candidate or not, based on truly their BMI. And then after that, we're looking for patients who are motivated, patients who are committed to following a program, to following education and guidance, and patients who are safe to go through a surgery. The surgeries themselves are very safe, but surgery is still surgery. We want to make sure that we're going to be able to treat a patient successfully and safely.
Sure, yeah. So this is not a process that happens overnight, but how long does it typically take from a patient making the decision to have this type of surgery to when they actually will have surgery?
That's a great question, and I think it's one that we all have to remind ourselves is this is a journey, and certainly from the time a patient commits themselves to pursuing this avenue, there are some steps and processes along the way. To make sure that patients are well informed, and make sure that they know their options, and make sure that we match up the right surgery to the right patient. But also to make sure that we've educated them about the process and about the nutritional components that go along with it. Surgery is not just an easy fix, or it's not an overnight success. It does take some time for it to work. And so patients will go through some psychological evaluation to make sure there's no underlying eating disorders that need to be treated prior to surgery. Certainly, if those are present, we can make those worse by doing surgery, and that would not be a desirable outcome for patients. And also, patients will need to undergo a period of nutritional counseling with a professional team for a period of 2 to 3, sometimes 6 months. Some of that is patient dependent on how well they're doing in the program, and some of that is insurance driven. Some insurance policies require longer terms than others. But we guide the patients through that, and we'll be right there with them every step of the way.
That's great. What makes the Wilmington Health bariatric surgery experience stand out in our community?
The Wilmington Health experience is just that. It's a community experience. We treat each patient as an individual. We meet a patient where they need to be met. Everybody brings their own situation to the table, and we recognize, honor, and respect that. And we're going to work with patients as far as they need to be worked with. And if every patient's individual situation needs an individual response.
Great. Well, if you're considering bariatric surgery, the way to contact Wilmington Health and our team is in the details of this video in the description, and we look forward to providing excellent care to you. Thanks so much, Dr. Stokes.
Thank you.